Good morning. Today we are going to speak about the perifrontal craniectomy technique for early decompression in cloverleaf skull. First, the anatomy of the bicoronal synostosis can be very different according to the age of the patient. In very small infant, it takes the form of a cloverleaf pattern, which shows ultra-early closure of all the sutures in the skull. And the skull can grow only from the fontanelles, that is the bregmatic fontanelle and the pterygial fontanelles, which gives it this telltale cloverleaf pattern. So we are going to see the perifrontal craniectomy step by step. First, we do a subgaleal dissection down to the orbital ridge. Then we expose the periosteum of the coronal sutures. We expose the bone by dissecting the bregmatic fontanelle from the frontal bone. And we have to fragment the bone using either the craniotome or the rongeur, according to your taste or to the possibilities. And we have to remove the bone all around the frontal squama. We go down to the orbital apophysis of the frontal bone, which is to be removed, and then to the orbital roof, and which leads to the midline, where we can complete the fragmentation in the Nasion area. In so doing, we have to be very aware of the ridges and the lacuna in the bone, where there is a high risk of dural tear and venous bleeding. The bone is much modified by the intracranial pressure. So we have to be very cautious during the subperiosteal dissection. We have to dissect around all the lacuna as shown on this diagram. We have to expose the bone edges and elevate the dura from the bone ridges, which can go very deep inside the sulci. And we have to fragment the bone between the lacuna. And to do so, it is very useful to practice the tango steps. That means 2 steps ahead and 1 step backward. And this way we avoid pinching incidentally the dura and damaging it. So first, the bone preparation. We have to make a large bicoronal incision to dissect the scalp down to the orbital rim in the subgaleal space. This way it is less bloody. There is no risk of opening the lacunae, except at the time of the incision. We have to be very careful during the incision. And then we expose the bregmatic fontanelle, and we dissect it from the bone, which gives access to the epidural space. Then we have to define the new coronal suture. We incise the periosteum on both sides of the future coronal suture, and we strip the pericranium down to the orbital pillar. Then we do the suturectomy. We remove the fused bone using either the rongeur or the craniotome, and go down to the orbital pillar. And we remove the orbital apophysis of the frontal bone, which is removed from the frontal malar synfibrosis. In doing this, we have to be very careful of the sphenoid ridge, where the cortical bone is thick, and it is prolonged by a large bone blade, which is the sphenoid ridge, which goes down very deep inside the dural folds, and we have to be very careful not to damage the dura at that time of surgery. Then, after having removed the orbital pillar, we can remove piecemeal the orbital roof, which is a very thin bone layer, and we join the midline, and so we have completely freed the frontal squama. So we obtain a very good calvarial expansion. In this case, the baby had a head -2 standard deviation at birth. This is a CT at birth, and this is what he became 2 months later. So we had really allowed a good growth of the calvaria adapted to the thrust of the brain. The morphological result is also fine because we allow the brain to give its shape to the calvaria. We have a round forehead, we have shallow temples, so this is satisfactory. However, we have to be aware that this is just the first time of a long process. So we conclude that the perifrontal craniectomy is an efficient technique in cloverleaf skull. It allows good frontal volume expansion, good morphological correction, and it is adapted to very young infants and even in newborns. It is performed in an emergency basis, but we know this is only the first step of management of complex multisuture synostosis, for which we wish him good luck. I thank you for your attention. You can see more videos online on YouTube in the playlist Cranio, and I see you later for other lectures. I thank you for your attention.